So this new epidemic of coronavirus, which has been termed as a pandemic by the World Health Organization, actually propelled us to upload few videos apart from the MCQ in AimExcellence with AimExcellence tag, because we have other channels which are doing that. But the thing is very important. Alongside the severity of the infection and the spreading of the infection across the countries, what is actually happening, the misinformation is also circulating all over the globe. And as you can see in the airports, the persons in the airport, the officials, are actually targeting something like this gun to the persons who are flying in. So what it is exactly? It's an infrared thermometer, and the people who are doing it in airport most probably are properly trained. But this is not actually happening only in the airports. It is actually happening various places like railway stations, like in the shopping malls, and somebody is spotting the gun on your forehead, it can actually send shivers down the spine. So you have to be aware that this is a battery operated. This is a battery operated first. This is a battery operated one, and we don't know what is the credential of the equipments that have been actually circulating in the shopping malls. So it can give you an erroneous result. It is not a foolproof way of judging the temperature of a person. It's an erroneous process. It's a fallacious process. And what they can actually spot by spotting on your forehead, they at max can see the temperature from your forehead, the radiating one. So you can obviously understand if this person is actually little away, the temperature is going to dip down here. So the temperature which is radiating from the person is depending upon where the gun is spotted, how much this person is trained, and how much this person is qualified enough. Because the knowledge of a person is very important, and whether how much the training is done, that is also going to be very important. So the persons who are doing in the shopping malls are most probably going to yield the wrong results. Number two, a person, you can sense a person is walking or running for even 500 meters, and his temperature, body temperatures are also going to go up. So there will be a spike. So in that case, whether that person is termed as, after checking it, if the temperature rises, whether the person is going to be termed as a fever. Even if it's so, or pyrexia, then it's wrong. Then it is wrong. And that is where you have to take cognizant of. So even if it is termed as fever, say a person who is a 60 or 65 years old going to the market, your Shoppers Stop or this Pantaloons or Reliance. So and the person actually spotting gun at you, and 65 years old, you can obviously understand their heart is going to tremble a bit. And then after the temperature is risen, and he have been told that you go back and you have a coronavirus most probably. Number one, fever is no absolute specific sign of coronavirus cases. This is not a specific sign of a coronavirus case. Pyrexia can happen to any infection, and many infection even without infection. As we have said, if you actually make a physical movement, your body temperature is going to go up. So after that, most of the coronavirus cases, you remember, there is no guarantee the person will have fever. So it is asymptomatic. it is good until then when it is just a preliminary checkup. It's a preliminary checkup, then it is fine. But there should be a procedure and a process, and the people need to be properly trained and have that much of knowledge to explain that to the person whoever is spotting the gun towards. There are many respiratory symptoms that can arise with the coronavirus, like there will be sneezing, there's the cough and cold. These are the very specific findings, not specific finding, many other infection can also yield that. So you have to understand, and government obviously have given designated centers in the state, designated centers centrally. So if you find any of the person in your family with the respiratory symptoms, actually please ask him or her to go to those designated centers, and that is going to yield more specific coronavirus infection cases. You can actually spot those cases only if the real-time PCR test is positive, and that is very important. Now you also remember one thing. Today I have seen one non-MBBS advertisement which is circulating that to take arsenic, they have that sugar coated medicines to increase your immunity, and it is circulating in one of the leading newspaper. So I request them to publish a report which is going to increase the immunity so much that it can thwart coronavirus cases. And if they can do so in today's scenario, because they termed as a pandemic, they have good chance to get a Nobel. So please do that. Important that we should not have paranoia or nihilistic delusion. We should be aware, we should be alert, we should support government and the administration, and then after, as a responsible citizen, we should support the government in each and every move they are taking to thwart this particular infection, but not get paranoid. What is actually happening, like this picture, and this is one of the MCQs or EMQs many times comes in, not only in Indian PG but in international licensing examination also, as a MCQ, single liner MCQ, also as a statistical problem, where the person is not having the condition is termed as having the condition, that is called false positive. That is actually what is happening most of the cases. Number 2 is the type 2 error, where she is pregnant, but it is the doctor is saying that she is not pregnant, means it is actually overlooking the cases too. So what is actually happening here in this particular circumstances, where people are actually over alert and over cautious and having a signs of paranoia, the type 1 error is actually overriding the type 2 error, and this can be your future EMS MCQ. You never know. They are looking at coronavirus so closely, and they are understanding what is happening all over India in real life, and they can put that in your question also. So hope this particular presentation helps you, and you also can see that every person is putting the mask, whether it is necessary or not, that is also very important. It is a droplet infection. It is actually till now it is a droplet infection, but obviously there are evidence of airborne infection till date. Already it is happening in China, and it is expected that it is also going to happen in India too. So there is where the concern lies. If it is going to be airborne. So all the activities, not only the public meeting, banning the public meeting, all the activities that is increasing suspended particular matter is needed to be thwarted, where the droplets are going to be more airborne, like construction. These things has to be controlled for 2-3 months, needs to be controlled, and till the temperature rises, till the summer heats. In Indian context, in summer it is expected the growth of virus is going to be lesser. Hope this information is going to allay few of the fears that you are having. Till at this point of time, there is no foolproof treatment, though the treatment regimens with the favipiravir, with chloroquine actually being tried, but you have to know the directive is also saying that you should give those treatments to only specific patients who are showing the clinical signs and laboratory proof of coronavirus infections and having the risk like cardiac arrest risk factors, the S2 inhibitors, they're involving S2 receptors, sorry, or TMPRSS2 receptors, which is actually earlier used in the prostatic carcinoma. And that is why we hope we are getting so many information which are related information and required information. So the drug of choice is going to come in the market within a month, hopefully. And hopefully this particular pandemic is going to be thwarted globally, and the citizen of the country and also the global people will get respite from this particular infection very soon. With God's grace, we will be able to achieve it. Until then, just stay alert, but don't panic, please. Thank you.